Can you give us your name?
Yes, my name is Betty Nunes.
And what's your role here at the Health First Family Care Center?
I am the dental parent coordinator for outreach.
And how do you become aware of the dental health needs of the people that you serve here?
Mostly because I do a lot of resource fairs through the schools and parks, and I hear from the parents and also from the school nurses, which is, there's quite a need out there.
And what kind of dental health problems do you hear about?
Mainly it's tooth pain, abscesses.
So people have a complaint when it hurts.
Exactly, especially with children.
Let's do that again. You might want to clarify that people rarely call to say, I need a cleaning or a checkup or anything like that, do they?
No.
No, okay.
So do you want me to say that they didn't really?
You rarely do that, right? Okay. So what kind of dental health problems do you hear about?
Mainly it's a tooth pain and abscesses. And most time people don't call unless they're in really a lot of pain. By then it's kind of hard to, to help them at that stage, except the antibiotics, of course. And then there's a process after the antibiotics. We have to have an extraction or a filling, depending on the need, and then the doctor's recommendation.
What are the biggest difficulties that you have in treating dental problems?
There's quite a few. Mostly it's an insurance barrier. Some insurance, a lot of places don't take certain type of insurances. Transportation problems, unfortunately. Transportation is the main thing in the insurances. But we are here to help them get insurances. We do have financial coordinators that help them, and we also have interpreters on site that help. That used to be one of our biggest problems, was a language barrier. But now we have interpreters that speak most languages.
With insurance, is everyone covered or not?
Everyone qualifies for one program or another. There's a lot of resources. That's up to financial coordinators to guide them through the maze of insurances.
So it's rare that there's no coverage at all?
Very rare. We also have free health care as well. But those do qualify for the free care.
Okay. How do dental problems affect other areas of people's lives, like school or work?
Oh, a lot of them, people miss work. Children, especially with children, they're absent from school, which is hard for them because then they have to catch up on their work. And they suffer too. They're in tooth pain. So it's very important for the parents to be aware, to have the children be seen every 6 months for their cleaning, which is it's very good oral hygiene.
Mm-hmm. Does people who are missing a lot of teeth, is that difficult for them in terms of their diet?
Oh yes, of course. It's you can't chew, and you can't eat certain foods. Plus, it affects your health as well down the road.
So even when we ask them to eat healthier foods like fruits and things of that sort, it may present a difficulty.
Correct. Especially like trying to chew corn, for an example. And if you have pain, all your teeth, it's hard.
So it affects their diet as well.
Diet, exactly.
Are there things that people can do to prevent dental health problems?
Oh yes. Actually, if everyone did this, would be a lot of people without pain. The most important thing is take time for yourself. Brush 2 to 3 times a day for at least 2 minutes, and flossing. That's very, very important. If you do that every day, not a problem.
So most dental problems can be prevented.
Correct.
And what are some of the things that we can do as a city to make it easier for people to maintain good oral health?
I think one of the things I think is very important is everyone should have health care, insurance, and dental. Because I think that's the main problem I find is people just can't afford it. It's expensive, and I think it should be universal. Every child, every parent, everyone should have insurance, whether it's medical or dental. They should have both, actually.
So people would be more likely to take care of problems rather than put them off?
Oh, they definitely would. Because that's why here in the community all the time they tell me I can't afford it. If I could, I'd be at the dentist or at the doctor. Even especially people with medications as well. They have a lot elderly, they take a lot of medications. It's very expensive. So I feel for the elderly and the children, because those are the ones that seem to need the most, and it falls through the cracks, I think.
Thank you very much.
I thank you.